thing that we treat in our office is low back problems. Low back pain specifically can have a couple different causes, but the one that we see a heck of a lot of is sacroiliac pain. What is sacroiliac pain? How do we diagnose it, and how do we fix it? That's today's video. Oftentimes when we're looking at sacroiliac pain, this is the joint between the tailbone and the hip bone, or the sacrum and the ilium. Oftentimes when I want to figure out if somebody's got a bad sacroiliac or not, what we'll do is we will poke on that spot, and you'll feel a little bony sticky outy thing here off to the side of your spine, but a part of your pelvis, and that's where the center of your pain is. One of the quintessential things to sacroiliac pain is that you get pain above the sacroiliac when you go from sitting to standing. So if you've been sitting for a while and you go to stand up, go ahead and stand up, Robert. You're going to feel that pain right over there. Sometimes you'll feel like I'm a really old man for about 3 or 4 steps, and it takes about 3 or 4 steps for that sacroiliac pain to kind of go away. And then once you're standing upright, you actually feel pretty good. Robert, if you will march in place for me. One of the best ways to tell if somebody's got misalignment in their pelvis is have them stand and march in place. What I want to feel when I'm doing that is I want to feel the spine have this perfect symmetrical movement pattern. If I feel this, where one side's moving more than the other, or one side's fixated, that tells me there's a misalignment. Assessing a sacroiliac joint is when you're laying face down. We'll look at your leg length. Leg length discrepancies can tell us a few things. Sometimes they just tell you have one leg shorter than the other, but oftentimes the leg that has a certain type of misalignment is going to be drawn shorter than the other. So when you go to see your chiropractor, he's always grabbing hold of your legs. What's the chiropractor looking for? We're looking to see if there might be a problem with your sacroiliac joint. I'm going to show you 3 different ways that we go about making a correction to a sacroiliac joint. The first one is what we call side posture. Oftentimes the chiropractor will put you up here. We grab a hold of the sacroiliac joint. We'll give you a quick thrust and a pull at the same time, and that's used to correct that sacroiliac. Another way that we go about correcting a sacroiliac joint is with a drop table. The drop table is a lower force technique than the one we previously described. This technique is going to use the table, specifically a chiropractic table, that's designed to be able to give way. When the patient feels that table give way, that's when the adjustment is delivered. An even lower force way to use this correction is called SOT blocks, or blocks. We use the blocks to wedge underneath the patient's pelvis in certain directions, and then just use time and gravity to make the pelvis straight again.